Today we're going to talk about one of the biggest public health challenges of our time, depression. And look, I'm not just talking about feeling sad for a day or two. We're talking about a profoundly disabling condition that has truly become a critical global issue. So just to give you a sense of the scale here, as of 2021, an estimated 332 million people around the world are dealing with depression. That's about 5% of all adults on the entire planet. This isn't some niche problem. It is a massive, shared human experience.
And the impact? It goes way beyond personal suffering. Researchers figure that depression and anxiety cost the global economy nearly $1 trillion, that's trillion with a T, US dollars every single year. A big part of that is from about 12 billion lost workdays. The economic shadow this crisis casts is just staggering.
Now, this analogy right here is the absolute key to how we understand depression today: a city blackout. We're going to keep coming back to this because it perfectly captures how this isn't about one little broken wire or a simple chemical imbalance. It's a complex, systemic failure with a lot of things contributing to it.
Okay, so let's get on the same page. What are we actually talking about when we say depression? It's so important to dig into the clinical definition because this medical condition is a world away from just having a temporary case of the blues. This is the big one, major depressive disorder, or MDD. To get this diagnosis, you have to be experiencing at least 5 specific symptoms for 2 weeks straight. And here's the crucial part. One of them has to be either a persistently low, empty mood or this key symptom right here, anhedonia. It's a medical term, but what it means is a profound loss of interest or pleasure in, well, almost everything you used to enjoy.
But here's the thing, depression isn't always an intense, short-term episode. You can see here how MDD contrasts with something called PDD, or persistent depressive disorder. While MDD is like a severe storm, PDD is more like a chronic, drizzly, gray state that lasts for at least 2 years. And sometimes they can even overlap in something called double depression, which, as you can imagine, is incredibly difficult to live with.
So why does this even happen, right? Why do some people develop depression while others, facing very similar pressures, don't? Well, the leading explanation we have brings together our biology and our environment. Nature meets nurture. It's called the diathesis-stress model. Diathesis is just a fancy word for a pre-existing vulnerability. Maybe it's genetic or from something that happened early in life. When that vulnerability smacks up against major life stress, like losing a job or a chronic illness, that combination can push you over a threshold and trigger a depressive episode.
And that genetic vulnerability, it's pretty significant. Research suggests our genes account for about 40 to 50% of the risk for depression. Now, genes aren't destiny, not at all, but they can definitely be a big part of that aging infrastructure we talked about in our power grid analogy. Let's look at the actual biological wiring for a second. When we go through chronic stress, our body's central stress response system, the HPA axis, it just goes into overdrive. It floods our system with the stress hormone cortisol. Now, in the short term, that's fine. It's a normal response. But long term, high levels are actually toxic to our neurons and can cause the hippocampus, a key part of our brain for memory and emotion, to literally shrink.
All right, here's something that might just surprise you. We always think of serotonin as the happy brain chemical, right? But get this, a staggering 95% of it is actually produced in your gut. This one fact points to a powerful connection that we're only just now starting to fully appreciate.
This is the microbiota gut-brain axis. Think of it as the communication lines between all the different neighborhoods in our city's power grid. When the trillions of tiny microbes living in our gut get out of balance, it can kick off systemic inflammation that travels all the way up to the brain and make depressive symptoms even worse. It's a huge reminder that mental health is whole body health.
Okay, so we've talked about the nature side of the equation. Now let's look at the stress part, because that stress isn't handed out equally. Social and economic factors cast a long, dark shadow, and they play a huge role in who is most likely to get hit by the blackout.
The link between income and depression is just stark. People with lower incomes are up to 3 times more likely to experience it. And this creates a brutal, vicious cycle. Poverty creates the kind of chronic stress that can trigger depression, and then the illness itself makes it that much harder to escape poverty.
The risk is also unequal across genders. Not even close. Depression is twice as common in women as it is in men. This gap seems to be linked to a whole cocktail of factors, from hormonal changes around childbirth and menopause to higher rates of abuse and socioeconomic disadvantage. And when we look at young people, the numbers are frankly alarming. 1/3, 1 out of every 3 college students now shows significant symptoms of depression. The intense pressure from school, social changes, money worries, it's creating a massive mental health crisis on campuses.
Now, after looking at how complex this problem is, it's really easy to feel overwhelmed. I get it. But that is not where this story ends. We are living in an era of incredible innovation when it comes to treatment. There is real, tangible hope.
For many, the road to recovery often starts with psychotherapy. An approach like interpersonal therapy, or IPT, can be super effective because it focuses directly on improving the quality of a person's relationships and their social world. And very often, this is combined with medication to help stabilize the brain's chemistry.
But what about the 30% of people who don't get better with those standard treatments? This is where things get really fascinating. Interventional psychiatry is a game changer. We're talking about treatments like TMS, which uses magnetic pulses to non-invasively reset brain circuits. Or medications like ketamine, which can give people rapid relief by helping the brain build new, healthy connections. So here's the crucial point, the real twist in the story. We have treatments that work. The problem isn't a lack of science, it's a lack of access. In low-income countries, a devastating 75 to 85% of people with mental health conditions get no treatment whatsoever. And the main reason for that huge gap? Stigma.
And stigma isn't just some vague feeling. It has very real, very dangerous consequences. A perfect example is something called diagnostic overshadowing. This is when a doctor literally dismisses a patient's real physical pain or symptoms just because they see a mental health diagnosis on their chart. It's a systemic bias that stops people from getting the care they desperately need.
Which brings us right back to our power grid. We have the technology. We have the knowledge to repair the system, to fix the wiring, strengthen the infrastructure, and manage the outside stressors. But those treatments can't work if they never reach the people who need them. So the real question, the one for all of us, is this: how do we work together to restore the light, not just for some of us, but for everyone?